ሰዓታችን ደርሷል። እንጀምራለን። ወደ 65 ሰው ይታየኛል። ድምፅ ይሰማል?
አዎ ይሰማል።
መልካም ጀምረን ሌሎቹ ጆይን ያደርጋሉ። ሰዓት ላይ ኮሚትድ መሆን ስላለብን ዌልካም ቱ ዘ ኢትዮጵያ ሜዲካል አሶሲዬሽን ፕሪ ኮንፈረንስ ሲኤምኢ ሲሪስ ማይ ኔም ኢዝ ሙሉጌታ በላቸው I'm a membership and CPD coordinator. I am here to introduce you to the CMC session and the moderator of the session. This is the second CME session of the day, and its title is From Textbook to Tutor, Synthesizing NotebookLM and Gemini for the Precision Medical Study. The moderator of this session is Dr. Amal Saleh. And let me introduce her. Dr. Amal Saleh is an associate professor of radiology at School of Medicine, College of Health Science, Addis Ababa University in Ethiopia, with a subspecialty in neuroradiology. She is the current president of the Ethiopian Medical Association, IMA, and leads the ethics subcommittee of the society and represents IMA as vice chair of the Federal Medical Legal Ethics Committee. She is also vice president of the African Society of Pediatric Imaging, and she also served as the vice president of Women in Nuclear, or WIN Ethiopia. In her previous role, she was the past dean of the School of Medicine, College of Health Science at Addis Ababa University. She has also held the position of chair of the Department of Radiology and head of the neuroradiology unit in the same institution. She has also served as the president of the Council of Medical School in Ethiopia, as well as the president of the Radiology Society of Ethiopia. And Dr. Amal works with African Regional Comparative Agreement for Research, Development and Training related to nuclear science and technology, AFRA, with the support of International Atomic Energy Agency, IAEA. She is the chair of high-level steering committee for human resource development and nuclear knowledge management committee. Dear Dr. Amal, now the floor is yours to proceed, please.
Thank you, Mulugeta, for the introduction. Let me put my camera on. Hello, everyone, and I would like to welcome everyone here, the participants, our speaker, our behind-the-scenes team from Yedinawag, as well as Emma. Hello, everyone, and thank you for joining us today. So, as you know, the theme is focusing more on AI this year, and I think this presentation is going to be excellent as it has a lot of hands-on training as well. So I will start by introducing our speaker today, Dr.Yoseph Yohannes, who is a medical doctor and data analyst with over 16 years of experience, bridging clinical medicine, health system research, and advanced data science. His clinical foundation was built during his tenure as physician at the Federal Police Referral Hospital, where he managed diverse clinical cases in a 200-bed tertiary facility and served as clinical mentor to improve standards of care. In the research domain, Dr. Yoseph specializes in quasi-experimental and mixed method study designs. He holds certifications in good clinical practice, research ethics evaluation and informed consent, and collaborates as an external researcher with institutes such as CDT Africa to build regional capacity for rigorous clinical trials and data management. He has also completed a Master of Science in Data Science. His technical expertise encompasses advanced statistical programming using Python, SQL, and R, as well as data visualization tools like Tableau and Power BI. Dr. Yoseph actively applies his skills to healthcare challenges, notably through the development of predictive machine learning methods. A key example of his work includes building a predictive health analytics model designed to assess anesthesia risks, in patients undergoing endoscopy procedures and leveraging statistical techniques to identify critical risk factors and to optimize patient safety protocols. He also participated in the development of type 2 hybrid research on comparative effectiveness and implementation research on copper dressing versus standard of care for acute traumatic wound management through collaboration with CDT Africa. He's currently engaged in grant projects by Save the Children on management of zero dose challenge in Ethiopia through a digital solutions that traces zero children through community health extension worker and triaging as deputy principal investigator. He has actively been working with the Ethiopian Medical Association as quality expert in development and collaboration with the Ministry of Health as assisting hospital accreditation as national flagship program. So with this introduction, we have a great speaker with us today, and we hope to learn from his expertise. The floor is yours, Dr. Yoseph, and thank you for being the speaker for Emma.
Thank you so much, Dr. Amal, for the wonderful introduction. Thank you, everybody, to be here for our pre-conference CME. Today, we are going to discuss about leveraging AI, particularly products from Google, NotebookLM and Gemini, for medical educations, particularly for medical students. But of course, such technologies can be used for quite large scale of workers, including for practices, researches, for any sort of knowledge synthesis. So let me share my screen and then I will start doing the presentations. I think my screen is visible. So on today, we're going to focus on the cognitive revolutions in medical educations, how AI is becoming a breakthrough in delivering education, in synthesizing informations. And today is about using NotebookLM and custom gyms for leveraging medical educations. So last time, before this CME, we have sent some questions about experience of using AI for the medical students. There is a very good responses. More students have started using AIs in their studies and their analysis of medical practices, which is quite important. So on today's presentations, we will briefly discuss about the benefits of using a general purpose AI, which is called large language model LLM, versus a customized technologies like NotebookLM. What is the differences, and what is the benefit of using such technologies? So maybe as you can see here, all of medical education is based on these giant textbooks and references, and we want our newer technologies to synthesize and consolidate all required information from such books. So as you know, the paradox of modern medical training is overloaded readers. So a medical student will be exposed to quite large number of resources from the medical PDFs, clinical guidelines, lecture transcripts, research papers, case studies. So consolidating everything, retention of knowledge is time dependent. So as the time passes, the amount of knowledge we can retain will substantially, reduced, so that, such technologies of artificial intelligence will have a very big impact in retaining by providing synthesized concept-based information to the medical students. So generative AI solves the black page problem for writers, but for medical students face an exponential increase in dense informations. This will lead to a cognitive overload, forcing students to do a passive type of studying, like memorizations, retentions, and repeated reading to return unimportant factors. And with AIs, technology like NotebookLM, such kind of cognitive effort overload and extraneous effect can be substantially reduced, and students will easily develop the most effective ways of retaining knowledge. Wait me, my screen, can you see? Yeah. So whenever we discuss about technologies of artificial intelligence, there is a very good areas of grounding sources of knowledge. When you are dealing with a general purpose artificial intelligence like ChatGPT or Gemini, whenever we send a queries, we get a general type of responses, and such type of responses can be derived from any kind of sources, which is really dangerous for medical education. As you know, we need to source our knowledge from reliable sources. So such kind of technologies like NotebookLM, it will create a secure vault architectures where all the source grounded intelligence will be put in those folder systems, so that whenever we send queries to the artificial intelligence, all the responses will be derived only from our sources. It doesn't generate responses from its general knowledge. So we can provide all forms of informations, documents, and it can ingest up to 500-page textbooks, which is, of course, quite small numbers for most of the textbooks. I'll show you how we are going to deal with it, because it's very important. The maximum page it can accept per a document is up to 500 or maximum 200 megabytes. And it will do a technique what's called RAG, Retrieval Augmented Generations. This is where the AI, when it responses, it can only references the available sources. It doesn't go outside its sources. It's very, very important. So the result, every claim is traceable. So whenever we have a doubt with its responses, we can check and cross-reference its output. So one of the biggest challenge in artificial intelligence is what we call hallucinations. Hallucinations in AI means AI is giving some random answers, which is not related. The reason hallucinations occurs is because of the very basic techniques of these technologies, these large language model LLMs. So the basic things AIs like ChatGPT or Gemini responses is by a technique called next sentence prediction. So whenever we give them some queries, it will automatically predict the next sentences. So whenever hallucination happens, it's giving some random unrelated answers is happening. This is one of the biggest challenge. So for example, ChatGPT can have like a 40% of chance of giving fabricated factors and temporal confusions, which is really dangerous, because AIs usually they confuse intertemporal relationship. If you give them some tasks on time related factors, it will automatically start hallucinating and give some unrelated fabricated factors. This is important. On Gemini, the base models, it's also have to has at highest level of hallucination up to 40%, fabricated entities, and it can also give you numeric inversions. Such kind of hallucinations is so dangerous for medical educations, where all your knowledge should be based on realistic and referenceable documents. So NotebookLM has one of the lowest among the industries. It has 13%. This is due to interpretive overconfidence and attribution drift. What it means is that sometimes AI, it has problems of affirmative actions. Whenever you give some tasks to the AI, even if it is on the wrong directions, it will give you some overconfidence interpretations, unless you intervene and try to give a very good directions. This is one of the most biggest challenge. So whatever is coming out as an output from AI, you have to be very cautious enough and cross-validate, even you are using NotebookLM. So the 13% error rate is grounded as rarely evolves in invented clinical values. So it enables students to use summaries for orientations, relying on provided inline citations, which I will show you later on, which is directly derived from the textbooks. So whenever we give the AI provides responses, it will provide inside citations where you can click and directly go to the paragraph and to the sentence where it derives such kind of information. So this is very important. Even in such scenarios, still you can face some degrees of hallucinations, and you have to be always cautious enough to accept whatever it's provided. So you never have to trust AIs because of this risk of hallucinations, and you can instantly verify it. So you can verify from different directions. I will show you then. So avoiding illusion of understanding is through the engineering of friction. So one of the best experience I can share with you when you are dealing with artificial intelligence as a user is there are two important factors which I believe will dramatically improve the performance of AIs. The first one is the context. If you don't give the AI the exact context where you want to play, the AI will give you just a generic response. So the first important is you need to give the right context for the solutions you want from the AI. The other is the right prompt or the right instructions. So a combination of right context and right prompt will give you the best. Even sometimes, sometimes you get the most innovative ideas from the AI so that you can entertain in your education, not only in education, also in your practices. So a combination of right prompts and as well as right context is very, very important. So you can supercharge your active recall workflows. One is through generating of targeted flashcard, which is one of the unique features of NotebookLM, which I will show you later on. And also you can create pathway exercises, and also you can simplify a complex scenarios where it would give you how to approach. So when you do your studies, it's not like in the old times when we're undergraduate students, where you have to indulge yourself in a big textbooks and try to use all your time trying to memorizing and studying everything. Now you can use different types of learning mechanisms. For example, you can create visuals, you can create audio, you can create exercises like flashcards, and also you can create what you call a flow charts. So with different forms of learning activities, you can create your knowledge retention mechanisms exponentially and significantly reducing your study times, where you'll be able to focus more on important soft skills, which enables you to become the most competitive physicians in your work life. So harnessing the testing effect on stressing the neural pathways. So active recall forces the brain to retrieve informations without notes, which outperforms significantly a passive reviews for long-term intentions. So NotebookLM will allow you to do what we call a question-based studying. So you can start asking the AI to give you some explanations, and it will give you responses so that you can directly try to understand the concepts from the practical point of view, which is very important. So it will generate some responses based on your questions, and then you start also asking based on the responses it can. So it's a kind of a loop where it will enable you to actively recourse. You can create scenarios even during your internship or during your clinical attachments. Whatever cases you find, you can give the scenario, the context to the AI, and it can give you all forms of how you can approach it, what will be the potential differential diagnosis, what type of investigative modalities will dramatically give you this opportunity to harness the questions. So with such AIs like NotebookLM, it will dramatically improves and entangles a complex pathophysiological and medical jargons, and will give you a filtered core analogies and fundamental grasp of the core concepts. For example, as you know, it can explain the pathophysiology of multiple sclerosis as if it is teaching a 10-year-old boy using a simple analogy. So if you want to understand the concept based on certain analogies, this technology can give such kind of complex pathophysiological phenomena in a simple way, that so that you can have a long interpretation of the concepts, and this is quite important for you. So the point is, this technology is primarily used for knowledge synthesis. So we can outsource our data to build and human intuitions. So where we ground our truth data through provision of core textbooks. So the AI, the NotebookLM or custom gyms will organize, and it becomes the processors where all forms of interrogations and all forms of exchange of information can happen, and you as a student and as a practitioners can develop the ultimate goal of becoming all the knowledge and the skills you can attain. This is quite important. So by trusting the AIs to manage exact diagnosis criteria and pathways, you can reserve 100% of your cognitive energy for the patient in front of you. So maybe to give you some context, as you may know, all these AI technologies have the free versions and paid subscription-based versions. So most of nearly 95% of your requirement can be covered by with the free versions. The only differences between the free and the paid versions is based on the type of the storage capacity. This NotebookLM can retain with the paid version will dramatically be improved. For example, on the free versions, in one notebook, it can contain up to 50 sources. So this is very important. Usually, you don't put maybe you may put like 10 or 15. If you put based on each subject areas, the maximum cannot go beyond 10 or 20. So the maximum you can create 100 up to 100 notebooks. So each notebook will contain 50 sources. So think with the free versions, you can store up to 500 sources to become full. So one source can contain up to 500,000 words per source, which are around 200 megabytes. This is quite big, but for big textbook like Harrison's Internal Medicines, you need to split it to multiple PDFs, because usually they are, I don't know, they reach up to 800, 900, or up to 1.2 GB. So we need to split it to put it all the resources into NotebookLM. So each day it will allow you to execute up to 50 charts, and three audio queries can be given. This is for the free versions. Of course, if you have the opportunity to go for the paid versions, all of these factors might be multiplied by 3-4 times. So you will have all these privileges. But for 95% of your requirements, all these factors are quite important. So the first phase will be ingestion and cleaning. So you provide all the relevant sources, including your textbooks, your transcriptions, your presentations, whatever you have in your hand, you can provide to your NotebookLM, so that once it's uploaded to the systems, all the information will be stored as a database. It's called vector database. So when you start communicating it, it will index from this database and will provide you all the responses. So you can put all your transcripts inputs, and it will automatically put them as an index, where it will give you all the important informations through its retrievals mechanism. So even if you are planning to go for USMLE board of prep exams, you can give it a scenario, and it will filter and will provide you all the important reasoning and the important responses, which will dramatically accelerate your studying time and your ability to retain the most important factors. So you can also simulate with the board environments. So if you plan to take, for example, a national entrance exam or a USMLE exams, you can simulate, and you can give him, for example, you can ask, you can prompt the NotebookLM to act as USMLE step 1 question writers, and you can request it to generate 10 multiple questions on cardiology, pathophysiology. Do not provide answers orationally in phase 1. With these instructions, it will automatically create 10 questions only dedicated on cardiology, pathophysiology of the cardiac systems. It doesn't go outside in other areas. And this will enable you to test yourself. And after you test yourself, you can subsequently ask for the right answers, so that you can assess yourself. So you can ask a blind quiz, and also you can provide a targeted review. For example, students can submit their answers, and the AI you can request to provide an in-depth pathophysiological explanation for the correct answers, and explain exactly why each distractor was incorrect. So it will it will evaluate your answers against the pointers to the correct answers, and it will evaluate your gaps. The other very important factors is it will enable to synthesize audio overviews, which is quite important, because sometimes there are different types of learning habits. As you may know, some students are visual, some are auditory, some are kinesthetic. So depending on the extent, you can generate certain discussions audio overviews, focusing on certain deep dive. For example, you can let the NotebookLM to discuss on the pathophysiology of certain pathologies, so that it will synthesize and it will give you some highlights about the medical information you want to retain. This is very, very important, especially for me, based on my personal experience. Whatever new information I want to understand it, I will send it, I will create audio overview, and then I will listen while I'm driving, so that I can retain. I'll get most of the details based on the audios. This is very, very important, and also based on the different sources you can create. You can create different folders within NotebookLMs. One that can assist you in generating a differential diagnosis. You can also create a Gemini or NotebookLM that can assist you in creating subnode automations. Also, you can create specialty specific preps on pharmacology or internal medicines. Depending on each areas, you can create different notebooks, and that's quite important, which will make your life so much easy and will make you most efficient and effective. So the absolute boundaries, one very important things I just want to stress while you are dealing with not only with NotebookLMs, but with every forms of artificial intelligence, is that we need to be cautious enough in sharing most sensitive information with AIs, because most of the free versions of AI will use all the interactions we have with them as a learning data. This is one of the most important things. So we do not, we shouldn't always give sensitive information, like, for example, a personal patient health information. This is quite important. Even in Ethiopia, we have a personal data protection proclamations, which inhibits exchanging, not only through AI, but exchanging very personal informations between even facilities. So in case you want to understand about a case scenario of a patient, you only give them a context, not a very specific personal information, health information, personal names, the diagnosis, and some like MRNs we shouldn't share. This is very important. You have to be always cautious enough, because we are exposing, and this is totally illegal, even in Ethiopian local context. So if you want, we shouldn't care. We shouldn't give birth dates, specific names, specific medical record numbers. So in order to avoid that, we need to de-identify health informations and text cases for training. So this is very, very important. So I just want to stress on it. So strategic directions, why we need to navigate NotebookLMs is the goal is to deep processing of massive textbooks and specific lectures. So the accuracy will give us the highest accuracy, and also all the responses will be grounded on the sources we provide. Will make the systems more reliable, rather than giving some randoms hallucinated responses. So the other important factor is we can cross references all the citations exactly to the source knowledge. This is in comparisons with the general purpose, AIs like Perplexity, ChatGPT, or Gemini. When, for example, Perplexity, when it provides responses, it will use real-time web search for the latest medical news, guidelines, and drug practices. The accuracy is moderate, okay? And citation to the link, external website can be done, but even the website might not be a reliable website, to get medical information grade, medical information grade sources. So if you use ChatGPT and Gemini, or still it can use free-form tutoring, brainstorming, talking through algorithms, but the accuracy is variable, and the risk of hallucination is quite high, and always it can be, misguiding, and some of its sources can be fabricated. So as medical students and practitioners, we have to be very cautious enough to use technology where all the responses are grounded only on the resources we can manage ourselves. Maybe in the futures, the previous experience is more or less in memorizations of the medical factors. So the ability to simply memorize fact being eclipsed. So memorization happens through repeated practices, repeated learning, reading. This will eventually be changed to orchestrators, where future residents will value portfolios demonstrating automatic clinical system analysis, moving away, moving from knowing what to knowing how to find and synthesize the right informations for the most complex medical conditions. So currently, when this general purpose AI launched some years ago, they were more or less chat-based AIs, so they will give a chat-based response. But now things are moving rapidly. Now we are on a stage where agentic AIs are becoming, common practices in these technologies. So where we give assignments to the AIs, and the AIs all do, they will, so look for the sources. They will cross-check different references and will synthesize and provide all the responses. This will definitely enhance the clinical practices in the future, and is quite important. So overall, implementing the master-based workflow, first, we need to focus on ingestions. So we need to create specific notebooks rather than giving all these irrelevant sources. And then we will do a multimodal priming. You can use audio overviews as a conceptual trailers before deeply engulfing in the text readings. We can use active retrievals through summaries. We can use interrogation methods to force mental frictions. And also we can learn clinical pattern mapping by applying a minimum information principles to distill the diagnostic signals for board preparations. And also we need to verify the synthesized informations. We can leverage inline citations to perform verifications mandates. And we can also go to the original sources to confirm for the nuances it produced. With this, I will go to demonstrate the concepts. I have all described so far. I was saying all about the theory parts. Let me go and share my web to show you about NotebookLM. Give me like 2 minutes.
Thank you, Dr.Yoseph. Until you share your screen, I think you have raised some very powerful points. I'm a little concerned with the statistics of 40% fabricated data from Gemini and ChatGPT. I think this is very important information for our students and our educators as well. We will go back to questions later on. So not to interrupt the flow of the presentation, you can go ahead and discuss your screen. Thank you.
Thank you, Dr. Amal. So here, what you find is an interface for NotebookLM. NotebookLM has been released, I think, 2.5 years ago. When it was released, first it was used as a knowledge repository systems, but has gotten very dramatic improvements. Sometimes it's so wonderful, and you need to entertain these technologies even after your completion of your studies, and if during your practices. This should be one of your biggest weapons where you can leverage all of your knowledge-based practices. So this is an interface of NotebookLM. In order to get NotebookLM, you go notebooklm.google.com. This is a Google product. What I'm showing you is a free version of NotebookLM. I had another paid versions for the sake of practices. I'll show you from both of sides. So when you open, you find such kind of notebooks. So as I said earlier, you can have multiple of notebooks you can create. So in order to create a new notebook, you just simply create new notebooks. When you click, it will automatically pop up this interface where it will give you different options to upload your sources. You can upload a file from your local stores. You can upload from the website, YouTube. You can upload from your Google Drive. You can even copy and text your sources, and it can automatically accept. On top of it, there is it can synthesize sources for you. So here you can see there is a fast research, and there is a deep research. So sometimes if you want to understand certain concepts and perform a deep research, you can click a deep research. What it's going to do with deep research is it will take maybe 5 to 7 minutes, and it will browse all the websites and will try to get some informations, and it will synthesize the information back to you. Usually for the medical education purpose, I don't recommend to use deep research, because it will give you something it can find from the website, which we discussed earlier with Gemini and ChatGPT. They are sourcing their information from the website, which sometimes is quite dangerous. So you can use deep research when you try to understand certain conceptual frameworks. Let me, for example, if you want to understand, for example, on the public health side, if you want to understand how, for example, the Minister of Health is moving, it's putting, for example, on the primary healthcare systems, the ministry is giving due attentions. So you can do kind of a deep research. You can ask, conduct an in-depth review and analysis of the programmatic focus of primary health in Ethiopia and other LMICs. You can ask such type of information when you want to understand some general truths, some programmatic informations. It can search from the ministry's websites, from publications, from even sources from WHO, CDCs, and it will give you such kind of information will enable you. This is not like a medical truth, but something you want to understand what's happening. For example, if you want to understand the health extension program, okay? So what's health extension? So such kind of information, you will not find them in a single textbook, right? So you can conduct some research, deep research about the health extension program. It will consolidate and it will give you all the information when it started, how many health extension workers have been recruited. You will get all the informations without sweating yourself. So with this, you can add all informations you can do from the website. So once I put my queries, I can immediately submit. So as you can see here, it will start planning, okay? And it will continue searching from the websites. And the final output will be the sources as well as the consolidated deep research report. This is very, very important. While it's searching, let's go back to the other NotebookLM where I created for the purpose of this CMS. Here, I have uploaded guidance, the textbook of physiology. Okay, so this NotebookLM is dedicated only to physiological. If I need to add more, I can click here and add more files. But one tips I just want to give you, especially for the medical textbooks, when you get them, so soft copies, they are carrying some encryptions and passwords where you are not able to simply, if you don't remove these encryptions, you cannot upload here. I will show you how to do that one. So once, as you can see here, this is a very big textbooks, and if the size, initially it was around 300 megabytes. So you have to do two things. If it is big, to put it as a single source, you can split it into 2 or 3 components, or you can do compression so that most of its component can be compressed. All medical textbooks have high resolution, pictures and graphics. This is creating the big megabytes of the textbook. So you can do compressions. If you do, a moderate type of compressions, still the AI can look at this image and can easily understand it. Okay, coming to the sources here. Here, this is the interface where you can do all forms of interactions. Okay, here is the studios. In these studios here, you can create audios, you can generate audios. So you click here, it will give you a different types of options. Okay, as you can see here, you can choose between short, default, and long audios. I had an experience that one time it gave me like 60-minute audio, so with nearly 1 hour audio. Think about it. This is quite a big audio. It's covering different items, so different sections, different concepts. If you want to deeply understand the concept, you can go with deep dive. If you want like a brief description, you can click here. If you want to do a critic kind of, an in-depth evaluations, you can click here. So this is a different even debates. You can create a debate. So there are 2 speakers in these episodes, and they will debate, taking certain points. So here, there is a point where you can put your instructions here. So this will enable you to select the point where you will, you'll select your topics. For example, if you want to understand, let's say, about mitochondria, so you can instruct the episode to focus on mitochondria, So if I just lift it, it will automatically read my puts and it will give some. Can you see? It is giving me some highlights. So I can put the tabs. When I click a tab, it will automatically giving me some suggestions. Now it's also bringing up some suggestions. I still can click it. I can click my tab, and it will give you. Are you looking at it? So it's giving me some recommendations. So still, I can. So now, just only on the mitochondria, I can do a bunch of different discussions. So here I will say generate. So it will, it will take some few minutes. Now it's generating the concepts. Okay, it will take few minutes, depending. Sometimes it will take like up to 10 minutes. You need to wait for it. While you are waiting for it, you can create also other important factors. The other is video. This is important. Video. You can also create a video where you can choose between explainer and brief. Here you'll choose a background, and here you can choose. You can put your instructions, and it will give you some feedbacks. Okay. Video also will take some time. And the other important factor is a slide deck, where it enables you to create a professional presentations. And this is important when you have presentations. You can do this, and it will create a very important presentation. By the way, now all these Google's AIs, the Amharic language is becoming a standard thanks to this, a concept called multilingual embedding, where it's not a translation, it's like, contextualizing between different languages. So if you want to create a presentation, you can create a presentation in Amharic. For example, here you can go down and you find Amharic. Here. So you can ask the instruction in English, and it will create a presentation in Amharic. Let's say if you want to create an infographic for patients to show them about, let's say we want to create some descriptions, let's say a cardiac or something for our patients, you can create in Amharic a very nice, let's say, a concise descriptions about pathology of cardiac. Let's say something like that. It will automatically create in Amharic, and you can entertain these things. Let me show you one output of an infographics where I did a mitochondrial engines infographics. So this is where it provides me. Maybe let me zoom in it out. As you can see here, it says mitochondrial engines powering cellular hemostasis. So it will give you all the structures as well as all this electrophysiology status of mitochondria. As you can see here, it's detailed, elaborative. It's giving you some figurative informations, how mitochondria related with the skeletal muscles, the cardiac muscles. As you can see, also all this electrophysiologic, how ATP synthesis is happening. So sometimes getting certain informations you can learn by creating such informative infographics and reading them. You can easily capture very important concepts, or you can listen through audios. The other very important tools in the studio is data tables. This is one of my favorites, where you'll be able to do kind of a summative, a summative point of comparisons. For example, we can create and create a table of comparison between intracellular, let's say, and extracellular fluids. Okay, even you can ask, for example, create a table of 10 comparisons. You can put also figures between intracellular and extracellular fluids. Okay, so it will automatically source from the web, from our sources, and will provide. While all these processes are undergoing, as you remember in my presentation, I show you that the benefit of NotebookLM is that it will provide you inline references. This is very important. So now here it's giving me some responses about the sodium pump fails, the gradient is lost. So if I want to cross check it here, I can just simply hover over it, and I will see its references, or I can go here and I will cross check. Even it's showing me a preview of the page where it's sourcing its outputs. Even I can click and it will automatically open up and take me to the exact paragraph where the sources has happening. This is very important. You should always cross checks, especially for critical factor, critical informations where you want to further provide. So this is where you can entertain. So we can also create flashcards. Flashcards are something
Dr. Yoseph, we can't hear you. Mulugeta, can you hear him?
No, Doc,
enable you to
I
understand
can't.
through questions and
Okay, Dr. Yosef, we lost you a little bit for like a few seconds. Just when you started about flashcard. Can you hear us?
On the level of difficulty from easy, set the number of cards. Okay, okay, sorry. Can you hear me now? Yes, now
Yes,
I can hear you. Can you hear me?
Yes, we can hear you. Can you please
great.
also speak up, as some of the attendees are saying they can't hear you very well?
Okay. So I'll go back to the point where I just stopped about the flashcard here. So you can click here and you can put certain points about, for example, so we can ask, for the focus on nucleus and its components. Apologies for my typos. Sorry. So here we can also generate a flashcard. So let me show you one of the outputs of the tables here. As you can see here, it generates a comparisons of between intracellular and extracellular fluids. Okay, here it says intracellular fluid, extracellular fluid, the characteristics, even the sources. We only have one source, but if you have like multiple sources, it will also put all the sources here. So with such simple requests, we'll get detailed conceptual understandings. For example, here you can see sodiums. We can understand the differences, and also it is giving us some remarks about the maintenance, its physiological significance. So such kind of data tables will enable you to grasp the concept in a short descriptions. So here it's giving you all the comparisons. By the way, you can challenge AIs to give you a different type of comparison. I'm just asking a very simple comparisons, but if I want a comparisons, I can ask, for example, I can check on pharmacology. I can ask different drug groups, and it will give me all the comparisons. So here, as you can see here, it's giving me something which I can read in 2 minutes and grasp the core concepts of this important concepts. So here, as you can see here, I can click here on the 3 dots. I can export to Sheet, Google Sheet. I can rename it. So even I can retain it. If I click and export it to Google Sheet, it will be exported to Google Sheet, and I can retain that information for the futures. Here, as I told you, I just created an infographic in Amharic. Okay, so የልብ ድካም አደገኛ የሰውነት መዛባት ውደት. So it's giving me some explanation of heart failures in local languages, and it shows you the progresses. So it's defining what's heart failures. የልብ ጡንቻዎች ደክመው ለሰውነት አልሚውን ኦክሲጅንስ ለማድረስ ሲሳናቸው ይላል። sometimes you find sometimes of typos ይኖሩታል especially የተወሰነ እንትን ላይ ዲቴይል የሆነ ጽሁፍ ሲያደርግ ማለት ነው። so you can create infographic in different languages. Okay, here is a flashcard which I created. Okay, here, so it's asking, it created 60 questions. Okay, so it For example, here, if you're giving me some questions, so the nucleus is separated from the cytoplasm by a double layer of structure called, I can, if I don't it, I can click X. If I know it, I can click right, and I can continue. So depending on it, it's also giving me some responses. So if I want the answers, I can simply click it. So if I want to see the answers, if I don't want the answers and I know it, I just click the right and continue. So depending on the extent, I can put the level to the difficult level so that you can check your knowledge skills based on the information you try from the sources. So this is overall what the free version of NotebookLM can do. The other important point, I just want to recommend you, when you come here, as you can see here, if we click it here, this is where you can customize your NotebookLM. Okay, so if you want your NotebookLM to give you a professional responses, for example, if you want your NotebookLM to be a learning guide, you can select this one. If you want to be a default, you can select default. If you want to create a custom instructions, you can click it here, and you can provide a custom instructions. One tip I just want to tell you is that by the end of our discussion today, we have prepared a giveaway where we give such instructions for you to use in new features. Okay, we have prepared 5 prompts, where one prompt is for physiology, one for surgery, one for a general purpose, one for differential diagnosis. So you can put all your custom instructions here. As you can see here, we can put up to 10,000 characters. So sometimes if the numbers, now we gave by 5,000 character, and you can put, and also you can choose the length of the responses from NotebookLM. You can make it short, you can make it long. So depending on your interest, you can select. So once I saved it and I can start, I can say, let's start. Because already I have given the system instructions, it knows how to start. So if I say, let's start, it will automatically start from the first phase where I just give them the instructions. Okay. So it's consulting the sources and checking my instructions, and it will start reading my inputs, which means the prompts, and it's also trying to understand my initial queries of let's start, and it will giving me all the responses. And now here it says, welcome, we are prepared to dive into the intricacies of mechanism of human physiologies. And now it's giving me the options. Where do I want to start my study? If I want from the cellular molecular levels, if I want to go to the fluid transport organ. So this is where I just want. So I can say, let's start with the organs, So I just say, let's proceed with organs. Maybe I just want to understand about, the physiology of liver. Let's say physiology of liver. So this is kind of, answering questions, kind of a bilateral discussions. Okay. So based on the instruction I gave to the systems, now it's getting my response and will take me to the second phase. So this is highly customizable, and you can customize your instruction based on your interests, and you can also try and improve it. Okay, so now it says we shall proceed to analyze the livers, the majestic and complex organs that serve such things. And now it says the normal mechanism. So what do I want to understand? The kinetic and physical mechanisms, or do I need the chemical metabolism mechanisms? It's giving me options, the storage and protection. What do I want to understand about the liver? Okay. So I can further, for example, I can select, I want to understand the storage and the protections. Okay. Even if I select this once and paste it here, it will continue giving me all the elaborations. So one tip I just want to give you is that here I have shown you on the studio, you can create all these forms of outputs, right? Even all of these outputs can be generated only also by the chat bots. Okay. For example, let it put some outputs here. So it's doing some analysis. So it's giving me, the blood reservoirs, all these elaborations. So I can create an infographic about the blood reserves. All these points it elaborates. So I can come here and I said, create an infographic about the blood reservoir of liver. Oh, okay. Sorry, apologies for my infographics, my typing error. So I can click it here. So immediately it will understand my questions, my query, and it will go and generate the infographics based on my query. So even without going to the studio here, I can ask to generate all of forms. For example, I can create data tables. Can you see here? Now it's generating based on the question. So even it will give me what it's going to generate. You know, rather than going there and asking, clicking here, coming here, clicking here and generating, I just ask it create an infographic about the blood reservoir of liver. Here it's telling me what it's going to do with this infographic. Okay, so now it has generated. Even I can say I can create a data tables, I can create a report, whatever I want. Even I can create quiz. I can say create quiz about blood so even if I click this once, it can automatically start working on it here, and it will automatically start generating quizzes specifically on these subtopics of blood reservoirs of livers. So you can ask very general questions, or you can go deep down and ask such highly specific concepts. So can you see here? Now it starts generating. This is based on my request on the chatbots. Okay. Okay, based on it has generated an audio overview. You can click play. It will take a few minutes till, yes. Maybe can you hear the voices from the audio?
We can't hear the audio.
Okay, you can't hear the audio, but I'm just listening to it. So you can create audios, you can download it. Okay, you can click here and download. You can rename, you can delete it here. So whatever you want, you can play around it. Here it has already created a quiz. I can click it here. So it has created 15 quizzes, and it's asking me. So according to Texas, what is the net filtration of the total capillary? So So you can create quizzes, you can create tables, visuals, audio, video, whatever you have. Even it can give you hints, and you can challenge yourself for whatever points you want to understand. Here, as you remember, I have also requested to create an infographics for the liver reservoirs, blood reservoirs. So it has created an infographics. Can you see it here? Such a very elegant and nice infographics. So says the livers, the body's strategic blood reservoirs. So it's giving you all these elaborations, the normal resting capacity, all the figures, giving you such a nice, you can easily grasp the core concept of the physiology and whatever you want to understand. Such a nice presentations. Okay, if you want, you can click here and you can download it as PNG or something. It can be downloaded. Okay. So you can ask, by the way, even you can prompt on the background of the image it can create. So there is different ways, but for the sake of purpose of educations, you can create such kind of standard infographic background. It gives you such an important. So as I show you, you can potentially create from a generic point to the big high level concepts. You can create such kind of points. Maybe let me go back to you, and if you have further points you want to get be clarified, I'll get back to you. Thank you so much. Maybe Dr. Amal, if any of the attendees have any questions, I will welcome to respond.
Thank you very much for this interesting presentation, and also a very practical approach on how to get things done. I was wondering where this was when we were in medical school, because this is not the way we did things. You have
that was what I also
yes. I mean, I have some reservations, but I will raise them at the end. However, you have a lot of comments and you have a lot of questions. So we can go to the questions. So the first question is, what was your experience like with Grok AI, especially in terms of its accuracy and hallucination rates? So that's the first question. Since you have a lot of questions, I think it's a bit difficult to group them because they're very different. Maybe you can address this question first.
Okay, thank you so much. You know, maybe based on my experience, I believe there is two important paradigms, with regard to the AI world, all these hypes and everything that we hear about AI. Personally, I'm not a fan, I'm not a person who loves to touch everything. Like, for example, for my workers, I use 99% Google Gemini and NotebookLM are my bread and butters. I use them every day for all forms of tasks. Grok, I have a very few experience. It was a very good one. It has a deep research, which was a year ago, was a very fantastic one. But ever since Gemini comes up with a version of 3, Gemini 3, everything has changed and Google became one of a big contenders in this AI world. And personally, I have seen its output has dramatically improved with the latest version. So now, personally, I don't usually use Grok. It has free versions, which has quite big limitations, and also a paid version where you get all these important outputs. So I personally recommend you to stick with one. By the way, I don't recommend to stick with one technologies because all these technologies have their own strengths and weaknesses. But I recommend you to test them in a way that's so unique to you and you understand them, how to play around with them. Thank you so much.
Okay, thank you so much. There's a related question, a comment from Frika Mariam. Thank you for the nice presentation. Which LLM do you recommend for day-to-day use for medical professionals, especially with regard to lowest hallucinations and for summarizing research papers? I think this is a very valid question in terms of particularly research where, we do see a lot of AI models being used that are generating fake, what can I say, sources as part of their publications. So it's very important in the medical profession to be careful with this. So do you have any recommendations in terms of research and for medical professionals?
I recommend to go with Google's Gemini Deep Research, where it gives you two options. One is you can upload your own sources. For example, you have all these research papers, and also from the website, it can source. So Google Deep Research is one of the best deep research you can find because it's an agentic AI where it autonomously searches all your sources, including your Google Drive. You uploaded it. It will allow you to upload up to 10 files. Even as you know, research papers are fewer in numbers. So you can also, if you have like, for example, if you have like 10, 20 research papers, you can merge them in maybe 2-3 PDFs and you can upload to it. Deep research, Google Deep Research is one of the best things you can use for research because at the end of its outputs, it will give you references where you can cross-check the outputs. So it put all these references and you can cross-validate the outputs.
Okay. Another question with regards to NotebookLM. Two questions. One is, how do I get NotebookLM for my laptop? And the other one is, you said NotebookLM has a 13% hallucination. And is there any method that can be used to reduce this hallucination? So one, how do you get it for your laptop? And two, how do you decrease hallucination?
Yes, if you have a Google account, Gmail, you can go to notebooklm.google.com and you can register using your Gmails and you can automatically get the free version of NotebookLM, which as I mentioned earlier, it will give you up to 100. You can create up to 100 notebooks within one user. Within each notebook, you can store up to 50 sources, audio, video, whatever you have. And the only requirement you need to have is a Gmail, and you can go to the website notebooklm.google.com and you can register using your Gmails. The other is hallucinations is still the biggest. These are the limitation of AIs. As I mentioned, even with NotebookLM, there is still risk of hallucinations. Hallucination is an internal problem, the weaknesses of AIs. It's still something all the big tech companies are trying to minimize. They cannot avoid it, but they are trying to minimize the hallucinations using different techniques. One is a reasoning technique. The other is using, a different. They have different models, and so before giving you the outputs, the question will be sent to different models so that they will take the average output will be released to the user. So one of the techniques, as I mentioned in the presentation, to reduce the hallucination is to cross-validate the outputs of your AIs. This is very important. If you don't trust your AI, for example, if it contradicts your beliefs, you can say that what I know is this one, you are giving me the other one. So it just give you you can understand, even sometimes it will understand its mistakes and will give you the correct answer. One tip I just want everyone to understand is that when you interact with AIs, you should be the one who's giving all the instructions. You don't ask them a question, but you instruct them. It's better to give them instructions rather than giving them a questions to reduce the hallucinations. Thank you.
Thank you very much. The questions are coming in, so be prepared for more difficult ones. So with regards to NotebookLM, you have answered the one for laptop. So I was trying to follow your presentation and try and create a prompt on my iPad, but I wasn't able to create any infographics. And you also have a question from Kifle. How do you create photographic and anatomical analysis using NotebookLM for medical education? So I'm looking at your prompt, and I think yours is also a free version for us so that we can follow it. I was not able to do any of the things. I mean, I did something. I don't know if it's any good, but I tried something. But it was difficult to create the infographics and anatomical analysis. Do you have any recommendations, or maybe, I don't know, how we can help our participants in grasping this knowledge? So do you have a quick fix for this?
This is very important point. To give you a scenario, let's say there are two users of AI. So they want to understand the same concept, and they interact with the AI, and AI is giving them different answers. Different in a way, like in terms of depth, in terms of clarity, and whatever the metrics you have. The differences between them, as I said earlier, two things affect the output of the AI. One is the context, the other is the instruction, the prompt. So first you need to understand the context where you want to interact with the AI. To give you context, for example, if you ask NotebookLM a general type of questions or a general type of instructions, it will give a high level explanations, but you as a medical students, you want to go deep, so you have to change your context. For example, if you are like a C2 student, you can tell them, create this infographic for me to understand about the concept of this in relation to that as a C2 medical students, so that it knows your context. It means it knows your background. It knows with whom the system is communicating. So context means giving all the circumstances. For example, me, when I'm using for research or whatever I use, I will give him all the context. For example, I will give him the purpose of my research. What's my target? So for whom that is interventions. For example, regarding this copper dressing, surgical wounds comparisons, I will tell him that my target populations are, adults more than children and adults more than 12 years old who have traumatic wounds, all these aspects. So context means telling all the stories, all your backgrounds. This will enable the AI to provide the responses based on your exact intentions. The other is a prompt. The prompt means the details. What exactly do you want to play around. So this is always important to keep in it. The difference is this. So if you want, for example, you don't know your context, you don't know how to ask. So even you can ask the AI, I just want to create a prompt based on this. So what area should I focus, or what instruction do you recommend me? It will revert back to how you should interact with the system again. So this is the way that you can maximize the output of the AI, the qualities and the usability.
So we need to practice ማለት ነው until we
Sure,
figure
sure,
out,
sure, sure,
until we
sure.
have
Sure,
a
sure.
relationship with this AI thing. One thing you mentioned it as a he. So now I'm worried if we should be assigning genders to our AI to our AI help. So I don't know. It's a bit concerning. So another question is, what are the risks of using AI on cognitive skills, and who is the appropriate person to use these AI tools, and when not to use AI?
This
So I think
is
the concern is that,
yes,
yeah, relying heavily on AI and losing
maybe
our cognitive skill. It's a
yes,
valid, very, very interesting question.
very interesting and very valid questions. I will give you a story, my personal experience. I'm a very big fan of AI, and my sister she's a lawyer, so I just created some custom GPTs, custom gyms, and I created some systems for her to use as a tool for for the legal all these prosecutions, all these proclamation and stuff. So after using this AI, now she become productive. For one cases which takes like 2-3 days for her to grasp, to write, to cross reference all these proclamations. Now it's taking her like maybe 2 hours. But one challenge she faced is that she starts to decrease in relying on AI. Sometimes you stop to critically start thinking. So the cognitive consequences is correct. If you are making yourself dependent on the AI, your level of using your mind, your cognitive capacity will drastically reduced. So what we need to do with AI, we need to leverage AI to increase our cognitive capacities. What I mean by that, for example, you as a medical students or any other health students, if you want to understand different segment of the health systems, you don't have, as in old days, you don't have to start from scratch. The AI will give you all these informations and it can synthesize all this information. So maybe with 1 month of studying or something, you can grasp the concepts, the experiences, which will take you maybe a year or 2 years. So you shouldn't be dependent on AI to give you a simple responses. You use AI to maximize your knowledge capacity and to maximize your cognitive capacity. So it should be a tool that enables you to think things in a way that you never thought it will be done. For example, let me give you a scenario where I do. For example, when I'm doing some researches. For example, there is an economic concepts in every research, right? We just want to understand the cost effectiveness of the researches, its implications on the policy briefing. So there is a dedicated health economist where they have all these studies, PhD levels, years of experience. For example, if I want to understand all these concepts, AI will help me to analyze, to understand things that will take me maybe years to understand. This doesn't mean but I'm going to replace them, but it's giving me the leverage that I can grasp the concepts from bottom up, and I can easily increase my capacity and my experiences. This is what I can say about the cognitive decline. Thank you.
Thank you very much. I think it's like having a cell phone. I mean, if you're in the older age group, we had the landline and we had to learn everybody's phone number by heart. Now with the
Yes.
advent of cell phones, we can't remember anything. We just rely on our phone, and we've lost our ability to memorize so many numbers. So
Yes.
I think it requires some balance in using AI for not for everything, but to make things easier. And I think there's a very interesting question, and I'm assuming this question is coming from an educator. where it's the question is, what are your recommendations and what shall we do with regards to medical students generation of history taking and physical examination from AI chatbots from their prompting, which is an interesting question. So we've been addressing the use of AI from medical education point of view in terms, from the point of view of students and from researchers as well, but not from the educators, where sometimes we, get submissions of, um, whatever assignment we've given, where it's been copy pasted from something, and it's obvious that has happened.
Yes, yes.
But we want them to learn, but also to, after they've done their own work, to use AI to further improve their work or to make learning easier. So what is the balance of using new technology in this era of medical education?
Personally, I believe the conventional educational systems is already old with this, all this, with the advent of all these technologies, AIs. The old education system is outdated, I believe, because we are forcing our students when, for example, when they go to the clinical years, we are, all the students are taking quite long times in taking histories, examining. I believe that such duration can be shortened by enabling the students to grasp, things that will take us a long time to understand. So I believe that AI will dramatically reduce for a person, for students to get the very deep level of expertise. And I believe that with the advent of AI, our educational system has to be changed drastically, because maybe you can assist me, Ahmad, when we graduate and when we finish our undergraduate and join the world of medical practices, we are starting from scratch, right? So I believe that this shouldn't happen now. When the students graduate and when they start working, they should be in a level where they're kind of experienced physicians, thanks to the AI, because we should change our focus, because now there is a tool, and the purpose of the tool is to accelerate in grasping of the core technological, the core concepts in the medical practices. And I believe that educations hasn't doesn't have to be such a long, medical educations hasn't has to be such a long, unless we believe that the practices, which of course the AI will not replace, but all this theoretical part of the medical education can be dramatically be reduced. This is what my belief. I hope in futures a lot of things will be changed. Thank you.
Yeah. Yes. I mean, I don't think we can get away from AI, and there is a big shift towards incorporating AI in medical education curriculums as well. For example, if you look at radiology, which is my field, we have put in something with regards to AI in the radiology residency program as well, because in imaging it's everywhere now. So there's a need to address it, but to make sure that it's carefully incorporated into an educational system. Where there was also an interesting question where someone was asking, does NotebookLM save the prompts or the questions that we give it? I believe it does, because that's how it
Yes,
learns. But you can
yes, yes.
answer that.
And unless you are a plus subscriber in the paid versions, it will automatically give a disclaimer that it's not using the conversation for training purpose. But all the free versions, they are using the conversation histories for the training purposes. Yes. That's why we don't recommend to
Yeah,
put personal health information,
exactly.
protected
Yes.
information.
Yes, that too, but also in research, if you put in a paragraph or part of your manuscript, your own manuscript, and you have further enhanced it significantly, if you submit your manuscript to some journals, it will flag it as being AI
Yes.
generated, although you're the one who put in your own information in there. So you have to be very careful when you want to improve your research manuscript, which you actually did, and you put it in the prompt, particularly the free access ones. Some journals will pick it up as being AI generated. So I think it's important to have a balance in that regard. I don't know if you've heard that. Yeah, that's some of the things that journals have been mentioning now.
Yes.
Another question is somebody, they missed part of your presentation because of network interruption, and they didn't hear how to download the app from Play Store because they tried to do it, but it says it's not available in our country. So I don't know if you've come across this.
Yes, there is differences if they are using Play Stores, iOS and Chrome. If they using normal computers in the iOS, there are some limitations, you know. So you can, but you can find it on your laptops. It's the app is available in Ethiopia for a long time. You can simply go to the notebooklm.google.com without downloading this app. You don't have, you can download it, but it doesn't have any additional benefits if you have the app. But you can directly use on Chrome. So in iOS there are some limitations, but you can use your Chromes and you can entertain. By the way, one good thing, I just from my personal experience, the user experience you have with the Notebook LM from your mobile and from your computer is the same. It doesn't have any limitations if you are using from your mobile. So if you start working on your computer and then you can continue on your mobile. So this will give you, you know, so much freedom for you. For example, if you are traveling or if you are on taxi, you can do your study while you are traveling on car or something. So whatever conversation you have, it will be saved unless you want to delete it. It can be saved here, so you can continue the discussions, and it will understand the context. If you don't remove the conversation histories, it will still use as a context, and you can go back to your earlier conversation and it can continue. So you can use your mobiles, whatever you have. Thank you.
Thank you. There's one question. It says, does it summarize based on frequency of ideas or importance of context? For example, if we upload 3 physiology books, so how does it summarize it? Is it based on the frequency of the ideas or the importance of context? This is something I
very
did think about.
important.
It's an excellent question. Yes.
It's an excellent question. It will take you to the physiology of AI itself. You know. By the way, AI is not it's not new things. You know, AI has been here for the last 50 years, starting from 1960, 70, 80. Different form of machine learning algorithm have been in practices. You know, all these regression models, classification models have been there, and the deep learning has been since the 2000s. The models of deep learning has been in the market, but the breakthrough happens in 2017, and where Google released its model called transformers. In 2017, Google published a very interesting article. It says what you need is attention, and it produced the first, big models. They are called transformers, and a very interesting thing they did. They make the models open source. In the IT world, companies when they produce a technology, they have two options. One, they can use it as their proprietary, as their proprietary ownership, or they make it open source for the whole world, so that all the developers will start working on it. So Google released transform models in 2017, and it make it open source. And other companies like OpenAI of ChatGPT, they were faster than Google and they produced ChatGPT. So what does transformer model means? There is a segment in data science. There is a branch of data science where it deals with unstructured data like textbooks, pictures. These are unstructured data. So it's called natural language processing, NLP. So with the introduction of transformer models, they become so nice that they will focus on the attentions. They develop what you call attention. What it means that when you give them a sentence, it will contextualize and it will understand the semantic meaning of the texts, and it will filter out the most important concept from these texts. So it's called attentions. What it does, it do is, you know, when we put some sources on NotebookLM, for example, guiding textbooks is not stored as a textbooks. It will be stored as a database. It will be stored as a numbers, by the way. It's called vector database. What does it mean? That every wording, every sentence, paragraph will have its own unique vector number. So, for example, if you ask them about cardiac, it will try, it will give, when we give them some prompts, some queries, it will understand the context. Maybe when I'm typing, I think you have seen how it's processing it, right? So first, it will try to understand the questions, and it will try to understand which component from their sources as the most important one. It's not based on the frequency. It's based on the attentions. It's called attention mechanism. So it will understand which point is the most attention, most important way. It is based on the vector database, and there is a lot of science behind it. It's called cosine similarities. For example, if you give them a junk book, and the vector number, for example, let's say it has a database of vocabularies. So the vector number between, let's say, king and queen is near to each other, that it understands that king and queens are related. But if you give them king and cat, the vector number is quite different, that even they understand that these are totally different items. So this is a trick that the technology has dramatically improved. The previous models before the transformers have a very big problem of memory. Okay. For example, you are giving them some stories. After 2, 3 paragraph, it will start forgetting the character. But now it can understand, even if it gives a 1 million token, or let's say 500,000, it will understand the characters from the chapter 1 and will relate to the character in the final chapter. That's why the AI becomes so powerful, because of these technologies. Thank you. So maybe I just give some jargons, but hopefully you get the points.
Thank you. For those who are having difficulties with the how to download, there's a link that has been dropped in the chat. So please go ahead and use that link to access NotebookLM on that. And there are some interesting comments about, losing our handwriting skills and how to spell, and a very comment that it's partly good news for pharmacists who are really worried with our prescriptions, but we're also losing our spelling skills, which is a very good point. With one
Yes.
same comment saying gradually we're atrophying because of AI, which is a very valid point as well. I agree to some extent. And there are a lot of comments. Everybody has been quite positive with your presentation and how interesting it was. Where do you draw the line between originality and AI-generated text? This is really an amazing question, because that's something we struggle with.
Yes.
And then there's another question of how to get your PowerPoint, but the video will be available, and our Emma team will guide you through how to access this presentation moving forward. Well, there's one question about, does AI read MRI CT so far? Well, that's a question for me, I think. And the question is, go ahead and answer your question, and then we'll come back to the radiology part.
In terms of creativity, I believe, by the way, all AIs cannot produce a new innovative concepts. If you ask AI, what it does is it will search all the sources, will provide the most relevant responses to your questions. It doesn't give you a novel responses. New novel answers cannot be from AI. But I believe, personally, I can be a good testimony that AI will help you in brainstorming to get the best practice from the world experience. Maybe let me give you what I was doing today, just for you to understand. There is one grant call which is focusing on the digital solutions, AI, digital solutions, innovative solutions in AI for research, for medical practices. So during our discussion with our team, there was some feedback coming from our colleagues saying that if you develop digital solutions for marginalized pupils, like internally displaced pupils, such kind of grants can be available. So I get such kind of this is a very important click point for me. And what I'm doing, I just go to AI and I start brainstorming with AI, and it gave me like four important innovative digital solutions where I can work with such kind of marginalized people. From the four brainstorming pointers, I selected one which I believe is the most important, and I start working on it. So I believe that AI can increase your creativity, but but it still depends on the level of your curiosity. It should be, you should use it in a way that makes you, most competitive. Not like, as we said earlier, you don't use it to be dependent on it. You use it to leverage it, not dependent on it. So this is very important. It can increase your creativity. Maybe coming to the imaging, you can Dr. Ahmad, you can reply on the imaging.
It's a tricky question. Yes, AI can help in picking up findings. Some generate reports as well. However, it's still a work in progress in terms of accuracy and what it can do. So there are a lot of AI tools that have been embedded in the MR machines and in the CT machines as well, that are enhancing the ability to pick up findings that are more subtle. And there are some that have gone as far as trying to look at, for example, because I do neuro, that's what I know, but looking at brain tumors, trying to grade brain tumors, trying to see the infiltration of tumors and so forth. So there is a lot of conversation, and particularly in radiology, there was a time when there was, particularly in the US and in Europe, where a lot of people were not joining radiology because it was predicted that AI would replace radiologists. So now there's a very big shortage in the global north. But they have realized that AI will not replace neuroradiologists. Rather, radiologists in general, but rather it will help in improving the reports that radiologists submit. So it can generate something, but it's not used to make decisions per se on its own. That's what I know about radiology. So there's a link also where almost 25 minutes left until we finish. The link has been shared by one of the hosts from Emma on the CME portion and the giveaway that Dr. Yoseph has prepared. And there's a question, a recommendation that could you recommend short training opportunities that are available for medical students and professionals to quickly learn how to use NotebookLM effectively? And some have also asked if it's possible for you to recommend some courses, short-term courses that they can use to better understand these concepts, like a 3 or 6 month course. I know Coursera has a lot of options to learn, which is free from great institutions, but maybe you have recommendations for other courses that you know of.
My personally, for example, I never had. Of course, personally, I recommend to follow up some influencers, especially on the YouTubes. There are quite very, very informative guys, which you will learn their experiences. The new kid, their experiences where they can maximally utilize. So personally, rather than sticking yourself to take one courses, maybe if you need a certification or something, you can take the courses, which is important. Maybe it will add values on top of your medical degrees. It will give you some leverages, but the best trick is to benchmark and learn from the experience of the influencers. So go to the YouTubes and try to search for influencers. There are a lot of them, which I believe are so fantastic people, and they will give you very nice and innovative ways you can leverage AIs. This is one thing. And I believe that with AIs, I believe that the medical doctors and medical graduates will be able not only to work on the clinical side, but also it will enable them to go to the research, to the technology side, for example, digital health, health informatics, implemented research. I believe, there is quite a large domain of portfolio where medical students can entertain and can easily join and use their medical expertise and experience and create differences thanks to the AIs. So taking a course is very nice. That's something that I recommend you. At the same time, also following and taking some influencers from the YouTubes. Personally, I have a bunch of influencers. Each days I get a new notification about new videos. I just see it. Sometimes it's you learn from people's experience. So AI is changing daily. For example, if you take a course which was released 6 months ago, that's kind of outdated for AI because NotebookLM 6 months ago and NotebookLM today is different. Maybe after a week, NotebookLM will get a massive upgrade. So the pace of change in AI arena is so fast that even with the taking courses might not be enable you to grasp the latest capabilities from your education. So in order to compensate that, I just recommend you to go to YouTube's and get latest daily updates from the YouTube's because they are creating videos daily, and since there is a fierce competition between all these tech companies, they are releasing new models, they are releasing new features, and you benefit out of these competitions. Thank you.
Maybe you can drop in the chat or your favorite YouTube influencers that you've been following to help those who are interested in further educating themselves with AI. There's one
Great.
question where without a computer science background, what are the best current pathways or courses to specialize in AI? So I think this has already been answered. So you can see what fits best for you. An important question on academia, how do we balance or reconcile this AI innovation with academic integrity and the sake of plagiarism as well in academia? And I think the questions are going to keep coming, but you have your post-CME quiz session that you have to do. So Mulgeta will walk you through that. So this is the final question for Dr. Yosef. However, it looks like a lot of people are really interested in this, and we can maybe think of having another similar session if you're interested in these kind of contents. And we would love to be part of your journey in AI. And we can work on something with the Ethiopian Medical Association to kind of provide some further insight into this. So Dr. Yosef has dropped some interesting YouTubers to follow if you're interested in continuing with AI. So Mulgeta, if you can quickly guide our participants who have stayed with us. We had over 140 something participants who were really amazing and asked really interesting questions, which we learned from your questions as well, and an excellent presentation by Dr. Yosef. And I really, really want to thank you for having this interactive session and for being part of this pre-conference CME. For participants, the EMA meeting will be taking place on March 27 and 28, and our theme is AI. So if you're interested, I would like to thank Yet Inawag for providing the platform, and everything will be available. The meeting will be streamed online. So if you're not able to come, don't worry, we will have it accessible to you, and you can join us from wherever you are. And all you have to do is be a member of EMA because it requires your password to access the online streaming. And please do join us. So please, join me in thanking Dr. Yosef for an excellent presentation And I also really want to thank the participants who stayed this long and asked the questions. You've made the presentation excellent as well. So Mulugeta, can you please walk everybody through the post-conference CME? I mean, we want you to get your certificates as well, so how to do your quiz. Thank you very much, Mulugeta.
Okay. Thank you, Dr. Yoseph and Dr. Amal, for a wonderful presentation. I hope you all participants learn how to leverage the power of NotebookLM and Gemini to transform your learning materials into personalized AI tutors. I invite all of you to join our tomorrow's pre-conference CME session, which will resume 11 a.m. to 1 p.m. and in the afternoon, 3 p.m. to 5 p.m. Finally, you can get today's post-session cues in chat box. Thank you.
Mulugeta, can you drop the quiz again into the chat box for those who joined late so that you can easily access it?
Is already dropped, and the PowerPoint materials also dropped in the chat box.
Okay, perfect. So participants, I hope you'll be able to see that, and please do join us for a continued session tomorrow, where we have speakers such as Dr. Atakilti, who's an amazing educator and thinks outside the box. So please do join us for that as well. So thank you very much, and have a lovely evening.
Thank you. Thank you so much.
Thank you.